Hi, I'm Dr. Carson Felkel, and welcome to this series of brief conversations on mental health and well-being during COVID stress, especially as our families return to learning and to school environments. At Bon Secours Mercy Health, we want to do everything possible to provide the tools to our associates, our communities, our teachers, to be able to thrive during this stressful time. I'm a child, adolescent, adult psychiatrist. I'm a husband. I'm a father of three young boys, ages 10, 7, and 3. And I'll tell you that I feel a lot of stress during this time. I don't have it completely figured out. But we're lucky that we have a guest, Dr. Aimee Drescher, on with us today. She's a clinical psychologist in Toledo and an expert on all things kids. So Aimee, I'm so glad you're here. If you wouldn't mind just telling us a little bit about yourself, maybe something about you as a parent, where your kids are in their ages, and is it normal that I feel so stressed right now?
Well, Carson, thank you for having me. As you said, I'm a clinical psychologist in Toledo, Ohio. I'm a generalist, so I do work with adults. However, I do have a child, adolescent, and family specialty. I spent about 15 years in California and San Francisco Bay Area and moved here 4 years ago back to Ohio, which is where I was born and raised with my 3 kids and my husband. My kiddos are 18, 14, and 6. So I have one going off to college, well, staying home for college actually, one that's starting high school and one that is starting first grade. So they are all in that transitional education time. So to answer your question, well, none of us have it figured out. So I'm right there with you. It is
Good.
completely normal for us to feel this way. I think that I've been working for the last 5 months with, patients and clients, managing everything that is happening with COVID. And at this time, going back to school is a natural transition, which brings about its own, challenges and anxieties. And now with the COVID-19 pandemic, it just makes everything, so much more difficult. I don't know about your school district, Carson, but mine, and all the school districts surrounding us in Toledo have just been changing back and forth between, all in person, all online, doing a hybrid schedule. I would ask, how is that working for you guys right now?
Yeah, we just found out yesterday that our kids will be going back 1 day a week to in-person learning, and then the rest of the time doing e-learning from home. And I'm working from home most days, and so that's really stressful, me managing their schedule, making sure that they're studying. I definitely feel anxious a lot. I do think anxiety is normal. It's our brains are built to have this alarm system to let us know that we maybe need to pay attention to our environment. But this has just been going on so long that our bodies are being flooded with cortisol. It can be detrimental, and we definitely got to change what we're doing to push back a little bit, build our parasympathetic system. I find myself getting very short with my kids. I might even raise my voice and start yelling, and that's my signal that I'm not doing what I need to do as a parent. I tell my patients all the time to do certain things. I got to do it myself.
Absolutely.
And those things are waking up early to work out. If I save it to the end of the day, I'm not going to get my exercise in. And we have a big garden outside. I love just watering and grounding myself by walking around without shoes on in the soil, just growing the plants. Those are just for me. Those are little things, but that works for me. What do you do, Aimee?
Well, you just completely shifted it over to self-care. So when we're talking about nervousness and we're talking about our anxieties and some of the ways that, we can naturally reduce it, self-care is a really big thing. So I also enjoy exercise. I'm also not a morning person. However, if I don't get it over with in the morning, it's not going to happen throughout the day. And I know that. I really like to organize things. And so sometimes that might work for some people and not for others, but I feel like if my space and everything is organized, then, I feel a little more organized. I also like to spend time outside. I do not have a green thumb by any stretch of the imagination. Most of the plants, that I have in my house and my office are not going to be real. And I also really try to find time in the day, especially with this transition back to school, to be able to spend time with my kids, where I'm the same as you. Like, my signal is when I'm getting short with people, I can tell that my, stress is rising. So I really try to find enjoyable time to spend with my kids, at least a little bit of time a day. We have, all of our routines, which are very helpful and important to creating some structure for our kiddos. However, we also want to build in that fun time where we don't have to be, have to be the parent for the moment, and keeping them on task.
Yeah, so I think you're really good at seeing the silver lining in things. I mean, it's hard being at home with our kids, but this is time that we might not have had before COVID stress happened.
Absolutely.
Aimee, what do you do with the fact that our school schedules keep changing? There's a lot of uncertainty. They could change again. Do we just need to control what we can control in our lives and let go of the other things? Or how do we just deal with this constant irregularity in our life?
Mm-hmm. I think in some ways I'd like to reframe that as, reducing our stress and reducing our anxiety instead of trying to control something, because I do think that, we don't have the ability to control everything. And oftentimes if we try too hard to control it, it actually backfires. So for me, I'd be thinking about, what are the things that are going to reduce some of that anxiety for me and that stress in my life, whether it be reaching out for support, from family and friends when that's needed. If it is, I do like to organize, so some of that might be just controlling my space. I also think that oftentimes turning to faith, can really help reduce some of that stress that we have and anxiety that we have in our lives, which is completely, again, normal to have right now. And not everything works for everybody. And I tell my patients and my clients the same thing. Here's some ways that might work. I can throw out a whole bunch of suggestions. And what we really need to do is find what works for you. So Carson, I would ask you, what are some things that help you on a daily basis when you're trying to manage your stress and be present in the home for your kiddos?
Yeah, you mentioned faith. There's a lot of little things I might do, but ultimately at the end of the day, I really have to just recognize that personally, because I believe in a higher power, I have to hand off some of these unknowns and worries. I can only control very few things in my life, but that is just tremendously helpful for me. I think setting a schedule for my kids is also helpful. Kids really do need routine in their day. Not a super strict conservative schedule, but they just need routine, something that's somewhat predictable.
Absolutely.
Aimee, it's been so great to talk to you today. We've got so many more questions and more things to come. Next, we're going to talk about kids are back in school. What could we do as parents at home if they are learning from home to just set an environment that is very calm? And I'll give you a secret about what we're going to talk about is about us staying calm first and foremost, at least appearing to stay calm when inside we don't feel that way. So more to come. Thanks for listening. We'll see you next time.